It's my honor to be here to give a presentation about the immunogenicity and therapeutical effects of antigen 85A and B chimerical DNA vaccine in the TB small animal models. I come from the Institute of TB Research, the Th1 Hospital, Beijing, China. So we all know the TB situation and drug resistance in China were very serious. According to the report on surveillance of drug resistance to Mycobacterium tuberculosis in 2008, there were about 8% MDR-TB patients and were 0.68% XDR-TB patients. Although the strategy of dots have achieved more programs in the TB control, but MDR-TB and XR-TB has emerged a new challenge, especially in the developing countries. And although the second-line anti-TB drugs have been used to treat the MDR-TB, but it's very expensive, less effective, and more toxic. So in developing countries, many TB patients have no money to use the second-line drugs. Also, the government lacks the funding to support the treatment of MDR-TB with second-line TB drugs. But till now, there were many studies have shown that immunotherapy could boost the efficacy of the immune systems. So in immunotherapy, maybe it's an alternative way for the TB treatment. So it has been proved the immunotherapy can assist the anti-TB chemotherapy to shorten the curable duration in the TB patients. There were many publications about using the DNA vaccine to use to treat the TB model. So it has been proved that the DNA vaccine could elicit both humoral and cellular immune responses to confirm practical and therapeutical effects on TB in animal models. So DNA vaccine maybe it's a novel and potential powerful agent to prevent and treat TB. And so in 1999, for the first time, Dr. Lowry used the DNA vaccine in the infected mice. So they found the Hishop protein DNA could eliminate residual Mycobacterium tuberculosis in the organs from infected mice. It proved that the DNA vaccine have the remarkable therapeutical actions. So in this study, we compared the therapeutic efficacy of antigen 85A DNA, 85B DNA, and 85AB DNA, chimerical DNA in the small animal models. We try to obtain new therapeutic agents or regimens to treat tuberculosis, especially in NDR-TB. So past one, I simply introduce our study, the results on the immunogenicity and protective efficacy of 85A and 85B DNA vaccine in the mice TB model. So C57BL6 mice were divided to 14 groups, but the time is not enough, so here I only introduce 85A and 85B DNA results. So the mice were vaccinated with 3 doses DNA at 2 weeks intervals. At 4 weeks after last DNA injection, the mice were infected intravenously. 4 weeks later, the mice were cured. From this table, we can know the specific antibody. It's higher. IgG and IgG2B were high level, so suggesting the Th1 dominated the Th1 immune responses. 85B DNA group DNA vaccination could decrease the lung CFU, but 85A DNA group have a lung CFU is similar with the vector group. 85A DNA have proliferated changes in the lung, but 85B DNA have exotic changes, but his exotic changes were lighter than the saline group. It's lighter. It's less the lesion. And so from this result, we know that antigen 85A and 85B DNA have some protective effects on TB, but it's not satisfied. So in part 2, so we try to evaluate the immunotherapeutic effects of 85A DNA vaccine in the small animal model. And a Mycobacterium strain isolated from the clinical samples. This strain is resistant to rifampicin, isolated stratomycin. The DNA sequencing showed that they have drug resistance genes mutations. So this strain is MDR strain. So we used these strains develop MDR TB mouse model. 3 days after infection, 5 DNA doses were injected at 2 weeks intervals. 4 weeks later, the mice were killed. And the histopathological examination showed that the saline group, vector group, the lung lesion were extensive without the granulomas. But in other therapeutic groups, the non-lesion is limited. They were more granulomas, And from this non-CFU or spleen CFU in the 3 control group were very high, and with function group also the CFU is very high, suggesting that rifampicin could not kill the MDR strain. So this is we successfully developed the MDR mouse model. Ag85A DNA, all combined with the rifampicin, the non-CFU is lower than the 3 control group. And so this results suggest the Ag85A DNA singly or combined with rifampicin had the best effect of treatment on MDR-TB mouse models. Although the rifampicin could not kill the MDR strain, but when the rifampicin combined with antigen-85 DNA, the non-CFU decreased. So maybe you will ask why combined with the antigen DNA, rifampicin could kill the MDR bacteria. We think maybe anti-5 DNA can stimulate the immune system and induce the dominant Th1 immune responses. So maybe he restored the Th1 and Th2 balance. So resulted in the enhancement of rifampicin effect to kill the MDR bacterium. And in the third part, so we try to improve the antigen-85A DNA effects. So we inserting the antigen-85B DNA into the endonuclease enzyme ACC1 side of the antigen-85 DNA. So we evaluated its immunocytical efficacy. And at the 3 days after infection, with 3 doses have been injected at 2 weeks intervals. 4 weeks later, the mice were killed. The antigen-85AB DNA can induce the mice produce the high-level interferon-gamma. Also, the flow cytometry shown the dominant Th1 immune responses. So, microgram chimerical DNA, 100 microgram 85A DNA have this chimerical DNA lung CFU is lower than the 85A DNA. But 25 microgram, 50 microgram DNA have higher non-CFU. This suggested we need the 11 amount of DNA for the better immunotherapeutic efficacy. We also evaluated immunotherapeutic of chimerical DNA in the guinea pig model. 7 days after infection, 3 doses DNA have injected. 3 weeks later, the guinea pig were killed. From the growth pathologies of springs, we can find the chimerical DNA and antigen 85 DNA have a lighter lesion in the spring compared with the saline group and vector group. In this study, we found that chimerical antigen 85AB chimerical DNA vaccines had observed immunotherapeutic effects on TB models. And inserting the 85B DNA into the 85A DNA can increase the immunogenicity and immunotherapeutic effects of 85A DNA. Therefore, chimerical DNA it's a helpful strategy for the development of better TB vaccines. So therapeutic DNA vaccine, it's a promising and affordable strategy for the treatment of tuberculosis in the developing countries. At last, I should thank my colleagues. Also, I should thank our partners. It's our BSL2 levels. So this is our institute. Let's all thank you for your attention.
Thanks a lot, Xueqiong. Any question? Yeah, just one question there.
It's a huge piece of work, but I could not understand the strategy which you used for experimentation. Like first you infected the mice, okay, for 3 weeks, and after that you started giving DNA vaccine, right? Was it like that?
Please repeat your question slowly, because...
Okay. You infected your mice first,
yeah,
and after 3 weeks of that, you vaccinated it, right?
3 doses.
Yeah, 3 weeks.
Yeah.
And then after 2 weeks of that, you collected all parameters. Was it like that?
Correct.
你听懂了吗?
Correct. First infected and then vaccinated. No?
什么?
Yeah, exactly.
Oh, it is okay.
你声音大点，我听不见。
If you like just to answer the question, helping the speaker.
My question was, you can translate that. You can translate that.
注射啊，这个在后面一次，我就没听懂，他是问第二次还是在？
Is it the correct strategy of for tuberculosis?
I will repeat your question. Okay, you asked me 3 doses DNA injection. After that, 4 weeks later, the mice were killed.
Okay, but infection was given first. So that is a correct strategy for a vaccine study? I mean, I'm a bit confused about that. That first infecting and then giving vaccine and then study. Okay. So that I am like, if it is established strategy, no problem. Otherwise, like, I was a bit